And now, from your local election headquarters, the only locally produced political talk show discussing the issues that matter to you. This is Big Country Politics on KTAB.
And thanks for being here for Big Country Politics. I'm Victor Sotelo. We start with the show with what's making political headlines across the nation, state, and the big country. And at Dyess Air Force Base, teamwork, working against the clock, getting things right, that's the competition that airmen at Dyess Air Force Base have been taking part in. It's the Global Strike Challenge. Previously, it was a competition between airmen. Now, it's Dyess against the world. KTAB's Jessica Rank has the story from Dyess Air Force Base.
Crews, are y'all ready?
It's a countdown from 5,
4, 3, 2, 1.
and they're off. 3 teams assigned to complete their own set of tasks.
We have a maintenance competition, we're going to have a bomb build competition, and then the crew chiefs, there's 2 of them. They'll be doing a pre-flight on the aircraft, and then whatever injet the evaluators will be doing.
And they'll have to do it all in just under an hour.
We actually have a goal of being under 40 minutes.
Staff Sergeant Edward Garcia Jr., part of this year's bomb loading team, is competing in the Global Strike Challenge for the first time and says the work to load 8 GBU-31s takes practice and, most importantly, teamwork.
We've been practicing a few times a week. We have our specific things that we have to do, but there's also times where we have to help each other and we have to get in and do each other's job just to make it a bit faster and make sure everyone is doing something. So teamwork is definitely a huge thing.
And while these airmen are battling it out for the best time, Senior Master Sergeant Michael Ledford says it's also teaching about real-world scenarios.
The particular loadout we'll be doing today is something that you would see in a combat situation.
When we need that actual asset to hit something, we want it there on time. So if we don't meet that time standard, then what's to say we can get the bomb there on time?
Each group hoping to prove that they're the best of the best when stacked up against other Air Force bases.
It shows that we're proficient at our job and that we can get the aircraft loaded in a timely manner and ready to execute whatever plan the commanders need us to do.
And even though at the beginning some were,
I'm gonna be honest, I'm a bit nervous right now.
in the end, a sigh of relief.
Good job.
And a handshake for a job well done. At Dyess Air Force Base, with coverage you can count on, Jessica Rank, KTAB News.
Now to our eye on education. The Texas Education Agency has released its ratings of schools across the state. KTAB's Mercedes Hernandez breaks down Abilene ISD rankings.
The Abilene Independent School District announced its ratings from the Texas Education Agency Wednesday afternoon, with the district overall receiving a B rating for the second year in a row. Superintendent Dr. David Young said administrators are celebrating highs and acknowledging some lows, one of those highs coming from Adams High School.
Adams, for the 4th year in a row, received all 7 distinction designations and was an A campus.
Those lows, though, coming from several Abilene elementary campuses, Bonham, Jackson, Lee, and Reagan, which all received an F rating from the TEA. But Dr. Young says the ratings, which are calculated through STAR test results, are not an accurate reflection of the work being done on those campuses.
When you have a student go to school for 172 days and you're going to judge their success or not, or the success or not of their campus on a snapshot that takes place over a course of 2 to 3 hours, if they just took 2 STAR assessments, I don't think that's appropriate.
Dr. Dan Dukes, Associate Superintendent of Curriculum and Instruction, says the district has no specific plans yet to get those fail ratings up, but that administrators will begin looking for solutions.
Right now we're just assessing our instructional approach overall, because that's really the right place to start, I think, is to look at what we're currently doing and see maybe what wasn't as strong this past year.
With the new school year just days away, the district has another shot at raising its ratings, but even more importantly, another chance to better the lives of Abilene students.
I just want us to be mindful that there is so much more that it's important that we do for our students to prepare them to be successful in the global marketplace. If all we do is create great test takers, we have failed miserably.
In Abilene, with coverage you can count on, Mercedes Hernandez, KTAB News.
And you can view the TE rankings of all the schools in the Big Country right now at our website at bigcountryhomepage.com. All right, and our eye on health. Struggling rural hospitals around the United States are getting a lifeline from the federal government. The Hamlin and Stanford hospitals are examples of Big Country rural hospitals shutting down. The Centers for Medicaid and Medicare Services have approved a plan to provide billions of dollars in additional reimbursements to help stop the epidemic of hospital closures in rural areas. KTAB's Washington Bureau Correspondent Jesse Turnor has more.
This issue of an inequity in reimbursement between rural and urban hospitals has been going on for years and really led to hospitals shutting down.
In the last decade, more than 100 hospitals in rural areas have closed their doors. Seema Verma, the administrator of the Centers for Medicare and Medicaid Services, or CMS, blames a flaw in the formula Medicare uses to pay hospitals.
It is based on wages, and so wages in urban areas tend to be higher, and so then every year the higher wage hospitals were getting more and more, and it was just creating a larger and larger disparity.
Verma says, for example, hospitals caring for patients with pneumonia in urban areas get $6,000 from Medicare, compared to only $4,000 in rural ones. A new CMS rule taking effect October 1st will change the formula to increase payments to rural hospitals, something Verma says translates to billions of dollars for these facilities.
The president is very committed to making sure all Americans are healthier, no matter where they live.
National hospital groups support the rule's intent, but worry it will end up punishing facilities in urban areas. However, lawmakers who represent rural areas, like Alabama's congressional delegation, are working with Verma to see this through, arguing it's a crucial step to make sure patients can get help all across the country. In Washington, I'm Jesse Turnor.
And experts say the Medicare system now favors hospitals serving the healthiest and wealthiest parts of the country, ignoring rural populations. Still to come here on Big Country Politics, we sit down with Sid Miller, the state ag commissioner. We're back in 2 minutes.